Welcome, everyone. I'm Laura Paynter, the Senior Director of Behavioral Health here at Buckeye Health Plan, and we're working to raise awareness around eating disorders. February 22nd through the 28th is National Eating Disorder Awareness Week, and the National Eating Disorders Association estimates approximately 30 million people throughout their lifetime will experience an eating disorder. With me here today is Dr. Alvin Pelt, our Behavioral Health Medical Director, to answer some questions around this important topic. Dr. Pelt, eating disorders tend to have a high prevalence rate of co-occurring diagnoses such as anxiety, depression, and substance use disorders. Can you please explain why?
Well, there are a range of factors involved in the onset of eating disorders, such as biological factors. That is your family history or your genetic predisposition. There are the psychological factors, such as low self-esteem and feelings of inadequacy. And lastly, there are cultural norms that overvalue appearance, and that results in body dissatisfaction.
Thank you, Dr. Pelt. And who are most susceptible to eating disorders?
Well, eating disorders can impact all people, all genders, all ages, all races, ethnicities, and body shapes. But the highest rates tend to be in young females.
And can you please share with us the various types of disorders associated with eating disorders?
I can, but first, let's define the term nervosa, which is used in a couple of eating disorders. Nervosa is a serious disorder of eating behavior that's characterized by pathological fear of gaining weight, and that leads to abnormal eating patterns, malnutrition, and excessive weight loss. The first eating disorder that you may have heard of is anorexia nervosa. That is a severe restriction of food intake because of the fear of gaining weight. The second is bulimia nervosa. That's characterized by binge eating followed by purging behavior, so vomiting. Next, there's a binge eating disorder, which is a recurrence of binge eating, but there's no purging or vomiting behavior. There's one called avoidant restrictive food intake disorder, and that is a general lack of interest in food, and there's some fears around food intake. And there are also other specific eating disorders, such as feeding or eating disorders that cause significant stress for the individual.
Thank you for all that great information. So what are some of the physical health impacts of eating disorders?
Well, eating disorders can impact an individual's physical health in a variety of ways. It can affect the cardiovascular, the neurological, and endocrine. And patients with eating disorders have the second highest mortality rate, only surpassed by those with opiate use disorders.
Wow, that's really surprising. So what can our providers do to help their patients?
Well, with almost every condition that we treat, early intervention. Early intervention can help support individuals through their journey of recovery. There are various levels of treatment available, ranging from outpatient to inpatient care, and several Buckeye benefits will include behavioral health counseling, and in some cases we use specific agreements or arrangements for inpatient care.
Thank you, Dr. Pelt, for all the great information today. And if one of your patients has questions or concerns, have them contact Buckeye's Member Services line for more information. And for additional assistance, the National Eating Disorders Association, or NEDA, is the largest nonprofit organization dedicated to supporting individuals and families affected by eating disorders and serves as a catalyst for prevention, cures, and access to quality care. Visit the website on the screen for more information.